I said, Pritpal is coming in. They said, who's Pritpal? I said, this guy's great. He's the only person I know in pharmacy that I know, pharmacy owner, and is ingrained within the contractor network, who's got a ponytail.
Hi, good morning. Welcome to the Pharmacy Planet podcast. I'm here today. My name is Pritpal. I'm from Sona, and let's start.
Welcome to the Pharmacy Planet podcast. Today I have Pritpal from Sonar Informatics. Welcome to the podcast, Pritpal.
Thank you very much. Thanks for the invite. It's lovely to be here.
Yeah, great. So do you want to just tell us a bit about who are Sonar Informatics?
Well, Sona Informatics is a provider of IT solutions for pharmacies. The company's been going since 2005. We've been providing IT solutions for services in pharmacies. So we started off doing things like needle exchange, supervised methadone, and so on. And we slowly worked up to working with the national services. So Sona provides all the national services on our platform that are things like, COVID across London and across the whole of England, actually.
Okay.
Flu, Pharmacy First, and those services like hypertension and contraception. And the latest one is the emergency contraception, which is a great service which takes patients out of the GP side and they can come and be serviced by pharmacy.
Okay, great. So let's just start about how you started in this business. So when you started,
Yeah.
it was, you don't mind me saying, it was a long while ago, right? So Sonar Informatics has been in the game for a long, long time. So
Yeah.
do you want to just tell us a bit about, where did you study first of all?
I went to the lovely city of Liverpool.
Yeah.
And
Oh, beautiful.
I had, I spent 3 years in Liverpool. Those times the course was just 3 years. And I wish it had been longer. I should have stayed. I still miss Liverpool. It's a wonderful city.
You don't support them, do you? Football team?
I do actually.
Oh,
Yeah.
God,
The thing
you've
is,
already
it's
started off on the wrong foot, pal.
it's not because it's not because my brothers support Liverpool.
Yeah.
It's because when I went there, it was that time. Kenny Dalglish,
Oh,
Kevin
yeah, yeah,
Keegan.
yeah.
It was in those years when
80s, wasn't it?
yeah. So we won the league and we won the European Cup and so on. And on the ground in near Liverpool station,
Yeah.
you would have people writing, Liverpool is magic.
Yeah.
Everton is tragic. So it's a two team city.
Yeah,
So
yeah.
either you're Liverpool or Everton. But I really only started supporting Liverpool when I went to Liverpool itself because I was in the city and I loved the city and the people I met.
Okay, and then from Liverpool, then you went on to.
Well, I did a master's at Chelsea, which is now part of University of London, but I did a master in biopharmacy. So when I came back to London,
Yeah.
I did my pre-reg in hospital in West Middlesex Hospital, and I met a really brilliant guy who was my tutor, a guy called George Lentos, and when I started my sort of pre-reg, he said, "What are you going to do this year?"
Yeah.
I said, "Well, I'm hoping to do my pre-reg." He says, "Why are you not going to do a master's or anything?" And it was the last day that you could actually register for the master's course. So he got me the morning off. He said, "Go and register."
Yeah.
And I registered, and it was great. We had 2 years, of fun. Yeah.
Okay, and then after that, then what? You bought a pharmacy? You locum?
I-
Worked for a pharmacy?
After my hospital pre-reg, I did a couple of it was quite amazing. I did less than 1 year in community pharmacy. I only did a few locums. The longest stint I had was working for the co-op, and I did about, I think, 2 months.
Okay.
And then I went to India. I went to India for 2 months, 3 months, and I did a few more locums, and I had the opportunity to buy a pharmacy and bought my pharmacy. So I bought my pharmacy really as a novice. I had no idea of what it was going to involve.
Yeah.
So I just learned it as we went.
Okay. Now, how did you go to make that this was quite a while ago. Now, pharmacies in those days, they were mainly dispensary driven, right? So a lot of the time it was just mainly item driven more than anything else. How did you even approach the whole IT side of the, how did you even get into that altogether then?
So really, what spurred me on to go into IT was a white paper that came out, around the 2000s.
Yeah.
And in it, I read it and I was thinking, how are we going to do this? And you had to make a record of your consultation with the patient.
Yeah.
And you had to communicate it to the GP. You had to take clinical records. That was really what we're doing nowadays. But at that time, we had just come out of handwriting labels
All right, okay.
or writing labels on a typewriter.
Yeah.
The very rudimentary IT systems that we had, they were not really conceived for pharmacy from a pharmacy services angle.
Yeah.
All of those systems really started from the wholesalers. It was due to supply side. The wholesalers started the IT systems
Yeah.
really so they could get their order.
Yeah, it was all a bit of a, it was all kind of like one circle, wasn't it? So a lot of
Yeah.
the time you get your systems from, or they were connected to a wholesaler.
Yeah.
But how did you decide to start your own though? What was all that about?
Well, I was,
What problem were you fixing exactly?
well, the problem we were fixing at that time, what we were trying to do was possibly create a website for pharmacies. We were trying to look at what sort of services we could do for pharmacies in the, when the patient needs support,
All right, okay.
So this was very, very early stuff. I mean, I came out with some, we were offering pharmacies websites in 2000.
All right, do you still do that?
No, we've sort of, what's happened is the journey, it's really a runaway train. As we got onto the journey, we found that there's other things to be done.
Yeah.
And my competitors in the IT world, I always tell them, come on. There's so much to do.
Yeah.
We have a lot to do still.
Yeah.
And it's nice that other people are also helping. I feel that we all need to help move forward the pharmacy profession.
But even getting in and getting that first contract, was it like hard work? Was it even how did you even cost the thing? Like when you first go in for something, you're not even sure how much it's going to cost you to deliver something like that, right? And
So-
especially if it's not your day job.
Yeah, so that aspect of did we write a business plan? Did we plan it? Did we have sort of an Excel sheet saying we'll be earning
Yeah.
X amount next year?
I've got a
None of
feeling I
that.
know the answer to this.
No,
Yeah.
no, we never. That was never on my mind. I mean, I have never been in Sonar
Yeah.
for the bottom line
Okay.
or for an exit strategy.
Yeah.
You see,
Well, you're
tho-
missing a trick here. I
Well,
think
we-
everyone's in on everyone's in on IT nowadays to get in and out. But go on.
Well, I think, the new companies that are coming in, I mean, especially the companies that are having a sort of, external investors
Yeah.
in their company,
Yeah.
where they've sold an idea that this market is worth X amount. I mean, those companies are following a sort of a model from Silicon Valley, which
Yeah.
is you go in,
Yeah.
you innovate, you fail fast and find the next solution. So one day they could be in pharmacy, next time they might be in Tupperware. We don't know.
Yeah.
You know what I mean? I'm a pharmacist. I worked in pharmacy.
Yeah.
If you saw me in my pharmacy when I was working,
Yeah.
you would not find me in the dispensary or in the back. I'd be sitting with one of my customers, probably having made them a cup of tea
All right,
and sitting and listening to them and seeing their story.
Well, I think those days are gone. You can't afford to do that in a pharmacy nowadays.
I know.
Not
I
with
know.
every patient, anyway.
I know, but the thing is that my heart is serving the patient, and as a pharmacist, I think the closest thing you have to really fun
Yeah.
is when you know what the patient needs and you can help them.
Yeah. But IT's evolving so quick. Like you're saying, there's so many new entrants coming in, and they're fixing problems you didn't even know you had, right? So there's people coming in thick and fast. What do you think about all these massive new entrants in? It's like
I
in
encourage
health
it.
tech as such.
I encourage it. Every new IT company that's come into pharmacy where I have had any communication with them,
Yeah.
I've always encouraged them.
Okay.
I mean, there are 110 problems to solve, and nobody's going to solve all these problems, right? There's not going to be one monolith. Like if I phone a lot of my pharmacist friends and so on, and they keep sometimes saying, "I wish we had just one system."
Yeah.
Yeah, if you had just one system, we'll go back to what we tried to do in the NHS in like around the 2005, the mega big projects.
Yeah. Yeah. Yeah.
And they failed.
Yeah.
The thing is that you need nifty small companies that can innovate, bring new sort of ways of working, and eventually those will permeate and create a system where pharmacists have access to what they need
Yeah.
to provide a really good service to their patients.
Yeah, I think, as a pharmacist, as a contractor, I get a bit frustrated with a lot of these new companies, especially when there's nothing wrong. Obviously, you need investors. Obviously, you need backing, and having some professional backing is always a good thing. But I'm finding new people are coming in, and it's all about, like you're saying, the Silicon Valley. Is it 5x, 10x? We're going to go 10 times this year, 20 times this year.
Yeah.
And they come in so thick and fast, like safety, clinical background, whether it's possible. Sometimes they have kind of like a clinical director who is just pretty much like just a post box. It's just a front because there's no clinical input. The speed at which they're trying to get in and out and grow, and it's almost like a giant sledgehammer. Go, 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 and then it's just failed, gone. And it's so frustrating because it's like can it seems like the patient is just a forgotten about part of the whole thing. They're just too busy trying to grow, and it's irrelevant. There's not even profit. It's not even on the table. They don't even care about profit. It's just about sheer growth in numbers as fast as possible. And
Yeah, I
it
mean,
is frustrating because a lot of people come to us, and it's like until you're 2, 3, 4 years in, I might not even look at it.
well, you're looking at a company that's been in for
Well,
a
I
bit
think you.
longer.
I think you've
So,
done your time.
yeah, so I mean, because our target is not like next year, saying, oh, by next year we must achieve this much market penetration or something like that. What we're trying to do is create a better and better product. And eventually, through word of mouth, people will come to us. And our whole focus is that the pharmacist has an easy way to make his record, communicate with the other layers of the NHS. I mean, primarily what we want to do is to help pharmacists to deliver the vision, which is that become a part of the front door of patient care. Like we have currently GPs, A&E, pharmacy, opticians, dentists, and so on.
Yeah.
And pharmacists need to just become the normal business as usual. Go in for your consultations, not just your medicine. If you have an earache, you go to your pharmacy. So really we want to try to help with that.
But do you think the NHS is actually going to deliver on that? Do you think everyone wants pharmacy to be the front door? Everyone's saying everyone can see it being the solution. Everyone can see it being part of the prevention agenda. Everyone can see we're accessible. But who's paying for this? It seems like no one apart from the pharmacist out of his own pocket. So how does this work?
So I think, from a national level, I mean, Sonar doesn't have any of these answers that you might think
I was just asking you. Don't worry about someone.
But what I'm saying is that from my perspective, I have a lot of deep respect for what the journey is in the UK for healthcare. If you look at how things have developed, we started doing vaccinations for flu in the 60s, early 60s, right? And we've been progressing slowly. Yeah.
Really?
Yes.
Pharmacists?
Well,
Must
not
have been.
pharmacists. I'm talking about the NHS.
All right.
Yeah?
All right. Okay.
So
Sorry.
the thing is that what I'm saying is that the journey of the NHS from the beginning of, Nye Bevan
50s.
starting it.
Yeah.
I mean, starting the NHS and
Yeah.
becoming such a ubiquitous, and everywhere you have the NHS. It's not only in certain areas. You can go to a small town, a village, you'll get the NHS, right? We're serving the population. I believe in the NHS, and whatever it is, it may not be exactly what we need it to be today, but I think the vision is there. The 10-year plan hopefully will deliver.
I think the NHS has a lot of problems. I think there's structural problems within the NHS,
Yeah.
and as much as I admire a vision, I honestly can't see it being if you carry on with the same funding model as it is now, yeah,
Yeah.
I just cannot see it succeeding in any way, shape, or form. I can't see it being fit for the future, the NHS, not at all. Not in its current funding model, the way it is, and its current structures as well. We know there's loads of other platforms there. There's loads of other competition. Why even Sonar? There's for us as a contractor, interoperability is a big thing. I don't want to use three, four, five different platforms. I only want to use one. And my problem with Sonar is a lot of the time it's not, well, it's not going to be interoperable with, but I don't think there's many platforms that are interoperable at the moment. And I think that's a big problem in pharmacy.
Well, interoperability is a word that means that your system can talk to another system.
Yeah.
So to do that, the other system has to open the door. We've been asking, the IT companies like EMIS
Yeah.
and System One and so on, saying we'd like to work with you.
Yeah.
And the door's always been shut.
It's closed shop, isn't it?
Well, they've been thinking that Sonar is a small company. They'll probably go away someday,
Yeah.
and we won't have to deal with them.
Yeah. Do they deal with other? They deal with other company?
Well, EMIS owns Pharma Outcomes, so
Yeah.
basically it's not EMIS anymore.
Optum.
Optum. So basically, we're not averse. We would like to work with them.
Yeah.
I've even paid them monies to join their whatever scheme is partnership. I haven't actually got the go ahead to.
You have to pay to join a partnership.
Yes.
How does that work?
Well, basically, if you look at their website, they'll have a list of partners at the bottom,
Yeah.
and those partners are paying. So you could get like a text messaging company that
Yeah.
partners with the GP system.
All right. Okay.
So they pay EMIS for a certain amount of money out of the money they earn, isn't it? And we would be willing to do that. Interoperability is two systems willing to work with each other and exchange information
Right.
so that it's instantly available, right?
Yeah.
So it needs two willing partners,
Yeah.
right? So, but the NHS is also now writing into the contracts of GP systems
Yeah.
that they have to allow GP Connect to connect. That's why every pharmacy in England can see a patient's record, because the contract for GPs is changing. And I imagine the contract for pharmacies will change as well, that you must have these systems that allow this sort of service.
But Pripad, the chances are, if my PMR offers this, I'm not going to go off platform. So this is a problem, right? Like this is, I mean, it's not a Sonar thing. Like, there's loads of other players out there, and I think, well, I really don't want to go off platform, not unless I can help it. So how are you going to fix that?
Well, I think it's my relationships with the industry and with the individual pharmacists that I believe that Sonar is delivering a service that's equal to any other provider. If not, we have certain advantages in certain areas. I mean, Sonar is connected with all these NHS services, and these new companies are coming out with whiz things that are new, right?
Yeah.
But they're not connected with
Whiz things.
whiz. Well, they say they're whiz things. In essence, what does a pharmacy need?
Yeah.
It needs a couple of things. It needs a good appointment system.
Yeah.
You need to
Are you doing that as well?
Yes, we are. We have an appointment system. You need a contact software so you
Yeah.
can text and email your patients. What else do you need? You need interoperability if the other partners are willing.
Yeah.
But then the government can demand it by putting a clause in their contract that you have to do these services, and that's what the journey we're on. And that's why I'm an optimist, that I think the government will enable pharmacies to get that information. For example, 20 or 30 years ago, you couldn't even phone the GP surgery and ask, "Can I get the blood pressure of the patient, please?"
Yeah.
No.
So,
Now you can log in to Sonar, click on a GP record,
Yeah.
and see that record.
well, okay. This GP Connect. Yeah. I'm assuming that it's available at Sonar at the moment, but I'm assuming this whole connection is pretty much going to become a standard thing in most systems. Am I right there?
I would say that, the plan is that, Sonar was one of the first 4 companies
Yeah.
that was on a journey to deliver these services, which we have delivered. All the
Okay.
4 companies have delivered. And now I believe that they're going to expand that to include
Which four companies are there?
there's Sonar.
Yeah. The
there's
best one. Yeah.
The best one.
best one.
Pharma Outcomes.
Yeah.
They've
which
been
is
around
one
a
of-
bit.
Yeah.
Positive Solutions.
Yeah.
And Cegedim.
Yeah. They're the four main.
They were the
they're
4 companies
Yeah.
that had the base that the NHS Digital thought that they could get these companies to
Yeah.
deliver what was required. I mean, it was very hard delivering this service over the last 3 years. I've had NHS meetings literally every day, a couple of times a day. Our IT team has been doing development all day long. It's not been easy. In the background, the amount of clinical governance, the writing a story about how you're safeguarding the patient
Yeah.
when you're creating this IT solution. Creating a bit of IT solution has a lot more than just presenting.
Yeah.
You know,
But all three of them are connected to PMR providers, right? The other three. Am I
are,
right?
yeah.
So this is where you guys are not, right? You don't see this as a potential
Risk.
risk, flaw,
like
issue,
I said,
however you want to
when
look
I
at
started the journey 20 odd years ago,
it. Yeah.
the PMR companies, they were, wholesaler based, just mainly doing a little bit of labeling with a whole wholesale order. But now, the PMR companies are doing what our journey was. So in a way, we did what we set out to do. PMR companies are going to deliver what pharmacies need. Now, Sonar will have to innovate and bring new stuff
Yeah.
so that there's relevance. And we're doing that. We're bringing new stuff because in the end, there will always be a market for various things.
Okay. You never thought about partnering with anyone?
Partnering, because, we're...
Like formally partnering with someone?
Yeah. So we would like to formally partner with some companies. I mean, we've had discussions around that. But, the last 2-3 years, we've been on it. Like, it's been like working in a bakery, it's been 24/7.
The other thing is, like, what I've realized is Sonar is probably well established in London, but pretty much in London, not nationally. That's the feeling that I get with our branches.
Yeah.
Would you say that's about fair?
Yeah, because I was, I've been always London based, and I've been able to walk in. I mean, when we had the primary care trust in the, before they closed them down, the medicine management teams of primary care trusts were all pharmacies.
Yeah.
So if I walked into a PCT and offered them what we were trying to do, they understood it. And when those guys closed down, and I think, that there was a disconnect. But during that time, I could get into London PCTs and basically they would say, yeah, that sounds interesting.
Yeah.
I didn't manage to go outside of London. I think it's a lot to do with in those days, how the PSNC worked.
Yeah.
The PSNC, the political body of the pharmacy, I didn't have much buy-in there, but
I'm surprised they were even involved.
Oh, they were very highly involved. They actually, they created their own IT platform for pharmacists.
That was
every pharmacist invested.
Was that the one before Farm Outcomes?
Before Farm Outcomes,
yeah.
Your pharmacies probably paid £1,000 per pharmacy to invest in an IT system that the PSNC.
And you were competing with them.
We were competing with them because obviously we didn't get out of London for various reasons.
Yeah.
But we are now available across England.
Yeah.
And later on, we hope to offer our services across other, the home countries and so on and so on.
You ever thought about just getting out, selling up? The landscape is changing so much all the time, Pritpal. I mean, it's just every business owner always thinks, when am I gonna when I've been doing it long enough, is it time? And especially when there's a lot of changes happening.
Well, look, I mean, we still have an unfinished job. We still think that there's a lot to do.
Yeah.
And I still got the energy to do it, and I want to do it.
Unless the offer is right.
I mean, we could have discussions. We may have discussions.
Yeah. Oh, look at that. Like, we're open to talk. You heard that, everyone. He's open to talk. The other thing I want to mention, when the team said, I said, Pritpal is coming in. They said, who's Pritpal? I said, this guy's great. He's the only person I know in pharmacy pharmacy owner, and is ingrained within the contractor network, who's got a ponytail. That was the one thing. And they're like, no way. I said, he's got a ponytail. And they're like, how old is he? I said, he's not a young lad. Yeah. Although you're quite young, but not a young lad. And they looked at this LinkedIn picture and they're like, he's got rid of his ponytail. I said, no way. He'd never.
That was an old picture.
I'm like, no way is he going to get rid of his ponytail. Yeah. The ponytail is Pritpal. So the thing is, the cameras aren't going to get it. We need a bit of a side view here, Pritpal. Look at that. It's still going strong. Still going.
My wife chopped it off a little bit. It's longer.
You know,
Can I show you a picture of me a
you
bit
can,
old?
yeah, of course, of course.
I don't know if you can get that.
What we'll do is we'll get the team to do a proper scan of it, yeah.
So
But this is
that's a picture of me playing five-a-side indoor football.
yeah,
That was back at uni, and we won. Well, we didn't win it, but we were aiming to get into the Guinness World Records,
yeah,
Book of Records,
yeah.
and we played indoor football for nearly 96 hours.
Okay,
And I'm still playing football.
and now you're in the Guinness World Records.
Well, you know, that record has been broken. But when the record was live, I used to be able to go to the Trocadero in Piccadilly
Yeah,
and take my children in for free
because you had
because we were in the. I was
So
in the Guinness World Book of Records.
I think there's some. I think you've got something here. You've got the ponytail. You've got Guinness World of Records. You've got a story. There's some background with Sono,
Well,
right?
I'm passionate. I believe, you know, like I live life, you know.
Yeah.
If you ever meet me
Yeah.
outside of this, you
Yeah.
know,
You like you enjoy a
I
good
might,
drink. You like going out.
I might even take part in your pub fund, whatever.
Oh
it is.
yeah, oh yeah. By all means, contribute,
Contribute.
or help me spend it even. Even
help
yeah,
you
yeah, spend it even.
help you spend it.
Yeah,
Definitely.
yeah. No,
yeah.
no worries.
Yeah.
Pritpal, where do you see pharmacy heading, especially now in this new AI landscape? Because you know it's all about AI nowadays. You want to add that in if you're going to sell up, by the way.
Yeah, so
Mention
that-
how you're fully AI enabled.
So that is one of our projects in the background. We're trying to bring AI into services. Now, you know, everybody knows that AI is not ready, fit for purpose. But you know, ChatGPT has just started a service in the United States
Yeah.
where they can, if you're willing to share your medical records with them, they're willing to give you some advice.
That's a bit of a risk, isn't it?
Yeah, that's a risk, you know. But in America, you know, I think people will probably try it. So you know, AI. There are many advantages of AI, but AI hasn't got to the stage where I think it'll be on its own work for patients.
Are you integrating it with any of your tech?
Yes, we are. We're looking at integrating AI. One of the things that I think that's so important for pharmacies to do in this new interoperability era
Yeah.
is note taking. When
Yeah.
you communicate with a patient, so important to make very good notes that when you send the information to the GP, when they read your notes, they are looking at a person sending them, like a clinician sending the notes. So it should be, it doesn't matter whether they came from hospital or from pharmacy or an optician, the notes that go between the different nodes of healthcare should be readable in the same way. So we want professional note taking, and
There's loads of systems that do that, though, aren't there? There's loads available. Like
no, but you know,
Heidi, and you know, there's a couple of others that are already available that already they're transcription, I suppose.
so what we're thinking of doing is that we will take the audio of your conversation with your patient with the consent of the patient, okay, and then translate that audio from your conversation, like today's conversation we're having,
Yeah.
and translate it into a way where it becomes a clinical note. So you focus on any discussion about symptoms and any discussion about previous history, and then any discussion about what your medications are, and then any discussions about the recommendations that you're making for the patient, and translate it into an easy sort of summary of that conversation, but so that the clinicians in the other node, like the GP side,
Yeah.
when they read it, it's easy for them to understand it. I think that's our next sort of project that we hope to deliver on soon.
Pritpal, everyone who comes onto the show, I ask them to make a donation to charity. So who's your chosen charity, and how much would you like to donate, and why? Why that charity?
Yeah, so this was a difficult choice for me, and I think I'm looking at the future of IT and the future of the world, actually.
The world.
The
That's
world.
that's a
Because I think one of the challenges in the future is getting information that is, that is safe.
Yeah.
Safe information is not going to come easy in the future.
You mean accurate?
Accurate and safe for children, safe for adults.
All right,
like
okay.
safe information, a safe space for information. And So I'm going to make a contribution to Wikipedia.
Oh, right.
Yeah,
Okay.
because I think we need Wikipedia or organizations like that
Yeah.
that safeguard the future of, the future of what's happening on the internet.
Yeah.
And that's where my
So,
money's going to go.
how much would you like to donate to Wikipedia then?
I think I'll contribute £500.
£500 to Wikipedia.
Yeah.
So that's a new one. That's different, to be honest. I never, when people turn around and say charity, you don't think initially, but they do. If you think about it, they probably do a lot for everyone for free, right? So you get a lot of information.
What I look at, if I want some information
Yeah.
that I can trust, right?
Yeah.
You can Google it, you can do, and you might get a link. The top link might be a charitable organization,
Yeah.
but they're sponsored and so on.
Yeah,
It may
yeah.
look like charitable, but Wikipedia, if you get a Wikipedia link,
Yeah.
I think it's safe for children to check it out,
Yeah.
for adults, for us as well. It's very difficult to get safe, good, honest information. I think Wikipedia
Yeah.
is doing an excellent job. I could have thought about another 100. There's another one I was thinking of, which is I'm looking at in the future creating some sort of foundation or something, and I'm actually doing it on a little bit of my farm in Punjab.
Yeah, yeah.
Which is that I've taken a back from agriculture, and
Yeah.
what we've done is we planted just nature. So we're planting trees on it,
Okay.
and it's going to go back to nature.
Okay.
Because one of the biggest stress things in India is that in Punjab actually,
Yeah.
the fauna and flora, the birds and all animals, they have no space. I remember when I was born
No
there.
space in India.
No space.
You think
in
they'd
it.
have plenty of space
in the
there,
Punjab,
no?
I remember when I was born in India.
Yeah.
And when I was about 6, 7 years old, when we went out of the village,
Yeah.
we saw like 20, 30 deer running around.
Right.
In parts of Punjab, you don't see that anymore. And so I think we need to, as humanity,
Yeah.
start giving space back to nature.
Yeah, that's
And-
quite an environmental goal there. No wonder. Here's me saying I'd have a giant 6-litre engine car, and here's you planting trees in India. I think
Yeah.
maybe I need to rethink my priorities. I think
Listen, the thing is that
I'm going to move from a V12 to a V8. I think you've had me thinking now. I really need to give back to society.
Yeah.
Do you know what I mean? V12 engines is not good. Do you know what I mean? V8 is acceptable.
yeah.
Got it.
But for the moment, I think Wikipedia is good because I think I feel comfortable in their organization.
Pritpal, everyone who comes on, I get them to join the revolution.
Yeah.
Make pharmacy great again. Pharmacy is going through a tough time, so I'm making sure that everyone knows that we want it to be great again.
So why didn't we have MAPGA?
So what happens is, I mean, the letter, the acronym, it can't really spell it easily, so it's a bit of a flaw in the revolution. I'm not going to lie.
alright,
Yeah. So it's one of those things that probably is something we really need to work on, because not everyone can say it correctly. But make pharmacy great again. Thank you so much. Thank
That's
you.
the mission. Make pharmacy great again.
That's the mission.
That's it.
That's the mission. We can do it, right?
Yeah.
Yeah, of course we can. Right. Oh, and also, I've got a shed load of merch for you as well. So we always have loads of merch for our guests. So
Oh, thank you so much.
this is for you to take away, so that you can also spread the word to make pharmacy great again. And join it's a revolution, not a cult, by the way, yeah? Because I had some people saying, is that a cult? It's like, no. It's a bit cultish. But no, the revolution, yeah?
There are many revolutions that have been interesting.
Yeah.
This is another one.
Got some quick fire questions for you. Right, Pritpal. Quick fire questions. Bloody hell. Jen, what are these? They're so long. Right, Pripal, I've got some quick fire questions for you. Now, these are conveniently AI generated, so I have no input into these until I actually read them. And some of them I read and I'm thinking, oh, it's a bit odd question. But anyway, yeah. Okay, Pripal, would you rather work from a beach with terrible Wi-Fi or an office with perfect Wi-Fi but no windows? That's an odd question, isn't it?
I'd rather go on a beach anytime.
It doesn't matter, right? What kind of question is that?
I'd rather
He's
go
be
on
on
the
the beach.
beach.
He'd rather go on the beach with terrible Wi-Fi because then he doesn't have to work because he hasn't got
and
Wi-Fi
also-
and he's sitting on the
also,
beach. Like, that doesn't make no
work?
sense.
Why work? Sit
Yeah,
on the beach,
exactly.
Enjoy the beach.
Yeah, that doesn't make no sense at all. Right, okay. High-tech electric car or classic combustible engine car? Are you an environmentalist?
I would say my vision is that we should all become environmentalists.
Yeah.
This misconception that we can carry on as we are, I think it's going to be doom and failure.
Yeah.
I think if I'd rather learn to walk, public transport. If I had to have a car, an electric car, a small one, not
Yeah.
too big. Yeah.
I love big engine cars. I'm the complete opposite. And not only that, combustion engines.
Combustion
the worst,
engines.
yeah, this whole like
You've been watching
this
Top
whole-
Gear too much.
Yeah, I love it. I love it. I think the thing is this whole electric car landscape. You know, when you're passionate about bog standard, combustion engine cars, big combustion engine cars, yeah, the electric cars just seem so boring. They are so boring. It's like now when I have to drive an electric car, it's like the smile has disappeared from my face. There's a smile when you drive a car, the feeling, the thrill of it. But when I have to drive an electric car,
The car is used to get from A to B.
I disagree.
Yeah.
I
When you
dis-
get to
well,
B,
well, you should
have all
be.
the fun at the beach.
No,
Okay.
no.
Okay.
I
Don't
want to
worry
have the
about
fun getting to the beach as well.
Yeah. But spend more time at the beach than the journey of A to B.
Would you rather present to a room full of CEOs or explain tech to your family? Well, your family's quite techie anyway, right? So it's probably
I
going to
don't
be
really want to talk to CEOs.
Really?
No.
I'm CEO. You don't
Yeah.
want to. You
No,
don't want
I'm
to talk.
you're not- I don't think you. Here we're not a CEO. You're not a CEO. I'm not a CEO.
All right.
Yeah, so I'd rather talk to ordinary people,
Yeah.
preferably like you.
Yeah.
In
Do
the
you
pub.
have to give a lot of presentations and stuff like that in your? You're probably having to sell all the time, right? If you're going into meetings with.
No, I told you we don't do any marketing. We may start some marketing. We hardly do any. Everybody who's using Sonar knows Sonar through word of mouth.
Yeah.
You know,
I think
nobody has been sold it.
I think this is a problem, no? The lack of marketing. You know, when I went online to look for Sonar Informatics and any background around yourself, there's nothing there. Like nothing. You would think, surely you want to get the name out there, right? How does this work? It's like, what? I just want to know, what budget do you have for marketing?
Oh, I mean, we don't really have a budget for marketing. I haven't spent any money. Well, we were at the Pharmacy Show,
Yeah.
and at the Pharmacy Show, we had lots of people visiting our stand. But really, it was there because you know what's happening in the NHS. You have to be there nowadays,
Yeah.
just to be let people know. But we're not really doing much direct marketing to pharmacies or to you know other avenues. You know, we're not in the chemist and druggist or in the magazines. You
You
know,
should be doing this sort of stuff, though, no?
well, you know,
I couldn't find nothing about there's hardly anything there. If you look online, look for PritPal, look out of all your, I mean, you've been in the Guinness World Records, you'd expect like there be something, but there's nothing there. There's nothing.
well, we hope to change that soon. But really, I've been on a journey. I'm sort of like maybe an optimist. I'm a perfectionist in a certain way that I want to. Before I start telling you how good we are, I want to make it really good.
Yeah.
So I think that journey has never finished. So I think we're nearly there. Yeah. So you might get some marketing bump.
Yeah,
But
yeah.
the idea is just to, you know, as it were, be a friend in the pharmacy space,
Yeah.
where people, when they talk to me, I answer them, and that's my marketing.
So your marketing is somebody talks to you and you give them the answer. I think I know you're a pharmacist and I know you're an IT guy, but you might need some advice on the sales and marketing side of it.
Probably, I'll admit that it, look,
I love that though. You
Yeah.
ask me a question, I'll give you the answer. What's your problem?
what I'm saying is if they have if they need to know about Sonar, they ask, and we will tell them.
Yeah.
Simple as that.
That's it for today's episode. Thank you so much, PritPal, for coming on to the Pharmacy Planet podcast.
Thank you for having us here, and I appreciate you giving us the opportunity. But you know, come over and see Sonar.
We're gonna have to.
Yeah.
Thanks, guys.
Like, subscription.
Like, subscribe, and share.
Not
Why do you always have to? You don't have to say these things, you know, Ash. People know that they've got to like, subscribe, and share. Or and if they want to like or subscribe and share, they're going to do it anyway without me asking them to do it. Do you know what I mean? If anything, it feels tacky, yeah. Don't you think?
Yeah. No, I think they're the experts. So if they tell us, let's do it. Why
No, you
not?
can't listen to them. Do you know what I mean?
I mean,
they don't mind if
I
look.
have
They'll make me look like an idiot happily.
I have
Do you know
zero
what I mean?
idea of what to do in the marketing space, but yeah, it's
All
good.
you have to say is like, subscribe, and share. I think that's it. That's all. That's it, right?